Good afternoon, everybody. And please, everybody stay here. We want to entertain you here for this last hour. Thank you for being here. We're going to talk about cloud computing and the impact on cloud computing on healthcare. And this is a term, cloud computing, that was introduced by researchers at MIT about 15 years ago. There's been an awful lot of hype about it, as you probably know, but for good reason. Cloud is a powerful new approach to solving business problems in a different, better, and potentially radical way.
We could try to reverse.
And it's worth probably taking a minute or just a very brief minute to say, what is cloud computing? Because I think there's probably some discussion, debate about that. But let's use this definition. Cloud computing is anything that involves delivering hosted services over the internet. Services that are broadly defined in three categories, those being infrastructure as a service, platform as a service, and software as a service, SaaS. I think a lot of people have heard of that. The switch to cloud computing is viewed similarly to the change from mainframe to client-server architecture, and it is indeed revolutionizing information technology. Three characteristics define cloud computing. It's sold on demand. One, it's elastic. You can have as much or a little of it as you want. And third, the service is fully managed by the provider. So with that definition in hand and just a word or two about cloud computing, let me introduce our speakers today. Our first speaker is George Halvorson, name known to many of you, if not hopefully most of you. He's the chairman and CEO of Kaiser Foundation Health Plan and Kaiser Foundation Hospitals, headquartered in Oakland, California. Kaiser Permanente is the nation's largest integrated health plan, serving nearly 8.5 million members in 9 states and right here in the District of Columbia. He has more than 30 years of healthcare management experience and was formerly president and CEO of Health Partners in Minnesota. George is unique, I think, in many ways as a CEO because he's written several books and takes time to do that and thinks about the future of healthcare. And he's just published a book that came out just this last year, 2009. I think he'll be available for that sometime later to sign copies and to speak to people. Let me introduce our second speaker, and that is Alfred Spector. Alfred joined Google in November 2007. He's responsible for research across Google.